Prenatal Care by Carol DeSalvatore, Danielle Saviello, Brittany Kinkiner, and Daniela Duran. Prenatal care is considered consistent health care throughout the term of pregnancy, monitoring the health of both the mother and the baby. Prenatal care practitioners include, but are not limited to, obstetricians, family practice doctors, certified nurse midwives, certified professional midwives, nurse practitioners, and doulas. Prenatal care consists of routine checkups, testings, and special care of both the mother and the baby while pregnant to promote and ensure a healthier pregnancy. Proper prenatal care includes monitoring risk factors to prevent complications and treat complications as early as possible. Prenatal care also includes nutritional education, ultrasounds, and diagnostic testing. There are many risk factors that are related to the complications of pregnancy. Prenatal care should begin 8 weeks after your last menstrual period and will continue up until the birth of the baby. Between 4 and 28 weeks of pregnancy, you will have one prenatal visit a month. During these visits, you can expect several things, including urine samples, blood pressure screenings, measurements of height and weight, calculated due date based on your last menstrual period, and your ultrasound. Your healthcare provider will also want to discuss present or previous health conditions, surgeries, or pregnancies, as well as your family's pertinent health history and your lifestyle, such as your exercise regimen. Early in the pregnancy, you will receive a complete physical exam, including a pelvic exam and a pap smear. During this time, you will also receive blood tests for various reasons, including to test your HCG levels, detect any presence of STDs, or any presence of congenital issues. Around 12 weeks, the healthcare provider will begin monitoring the fetal heart rate. Ultrasounds will begin at 8 weeks to confirm and date the pregnancy, and then again, you will have an ultrasound between 18 and 20 weeks for an anomaly scan, which is more commonly known as an anatomy scan. This measures and observes the baby for normal development. Between 28 and 36 weeks, you will start to receive one prenatal visit every 2 weeks. A glucose screening for gestational diabetes will be done between 24 and 28 weeks. A Group B strep screening is done between 35 and 37 weeks to test for GBS. Group B strep is a bacteria normally found in the vagina of 25% of healthy women. However, this could be harmful to the baby if passed during delivery. A non-stress test will be done anytime after 28 weeks to check on the fetus's health. Between 36 and 40 weeks, you will begin to receive one prenatal visit per week. Each week, your healthcare provider will assess your weight gain, your fundal height, the fetal heart rate, and check the fetal positioning.
Prenatal knowledge, appropriate weight gain. During pregnancy, an appropriate weight gain would be anywhere from 25 to 35 pounds during pregnancy. If a pregnant woman is underweight, the total weight would be anywhere from 28 to 40 pounds, and overweight 15 to 25 pounds. Prenatal knowledge, nutrition. During pregnancy, it's important to have adequate intake of proteins, carbohydrates, calcium, iron, fats, and various vitamins and minerals in your diet. However, to ensure the appropriate amount of each recommended requirement of good nutrition during pregnancy, a daily prenatal supplement is essential.
Prenatal nutrition, important vitamins and minerals. There are several important vitamins and minerals to make sure that we include in our diet to decrease the risks of any neural tube defects or any birth defects. Vitamin A helps bones and teeth grow. It's found in milk, eggs, carrots, spinach, broccoli, potatoes, and cantaloupe. Vitamin D helps promote strong teeth and bones, which is also found in milk, fatty fish. Vitamin E helps body formation and use of red blood cells and muscles. It's found in nuts, spinach, and fortified cereals. Vitamin C, which protects tissues from damage, helps the body absorb iron and builds a healthy immune system. Vitamin C can be found in citrus fruits, bell peppers, green beans, strawberries, broccoli, and tomatoes. Thiamine, B1, it raises energy level and regulates the nervous system. We can find thiamine in whole grain, fortified cereals, eggs, rice, pasta, berries, nuts, legumes, and pork. Riboflavin promotes eyesight and healthy skin. It's found in meats, poultry, fish, dairy, and eggs. Niacin, also known as B3, promotes healthy skin, nerves, and digestion. It's found in high protein foods, breads, meats, fish, milk, eggs, and peanuts. And vitamin B6 helps form red blood cells. It's found in chicken, fish, pork, eggs, spinach, bananas, oats, and peanuts. Vitamin B12 is an important factor in DNA synthesis. It may prevent neural tube defects. We can find vitamin B12 in shellfish, pork, eggs, dairy, and poultry. Folic acid supports the placenta and prevents spina bifida, found in oranges, strawberries, leafy green veggies, beets, cauliflower, pasta, beans, and nuts. Calcium helps form healthy bones and teeth, prevents blood clots, and helps muscle and nerve function. Calcium can be found in yogurt, milk, cheese, and leafy green veggies. Iron helps in the production of hemoglobin. It prevents anemia, low birth weight, and premature delivery. Iron can be found in beef, pork, dried beans, spinach, oatmeal, and dried fruits. Protein helps in the production of amino acids and repair cells, found in animal foods, meats, poultry, eggs, dairy, veggies, legumes, nuts. And finally, zinc helps produce insulin and enzymes found in red meats, poultry, beans, nuts, whole grains, and dairy.
Risks of poor prenatal care. Age. Women who aren't fully developed yet have an increased chance for premature birth and low birth weights. Women over the age of 35 increase their risk for hypertension and diabetes. Uncontrolled can cause miscarriage and birth defects. Weight. Women who are overweight have an increased risk for birth defects, including cardiac issues, cleft palate, and lip, and hydrocephaly, as well as spina bifida. Underweight women can cause premature delivery to the infant. Diabetes. Detection of gestational diabetes is extremely important. Poor control of sugars can cause birth defects or fetal death. STIs. Without prenatal care, there is an increased risk of passing the STI to the newborn. Certain STIs put the mother at an increased risk for miscarriage, premature labor, and the fetus is at risk for low birth weight, pneumonia, sepsis, blindness, deafness, liver disease, and meningitis. Risks of poor prenatal care. Pre-existing conditions, uncontrolled medical conditions are more likely to cause complications during pregnancy. Hypertension, autoimmune diseases, kidney diseases, thyroid diseases, and asthma can lead to a number of complications, including preeclampsia, premature birth, low birth weights, stillbirths, and heart failure. Multiple pregnancies. Mother is at an increased risk for excessive bleeding during labor. Reproductive abnormalities. There is an increased risk for labor difficulties that usually result in C-section. This is a map of the United States with statistics for prenatal care from the CDC. This is a chart of the percentages of mothers receiving late or no prenatal care by race and origin. This is another chart that has the percentages of births to mothers receiving late or no prenatal care, and it's categorized by the age of the mother.